Hello, my name is Ben Victorica, and today I'm recording a video on HIPAA compliance as it relates to copy, print, fax, and scan. I work for Notable Solutions. NSI has a 15-year history as the industry leader in distributed document capture. We've helped thousands of healthcare customers ranging from military hospitals to VAs to commercial hospitals and surgery centers and home care, and our focus has been on security, compliance, and cost savings. Our mission is to support your mission, to help you improve patient care while doing it securely, to reduce cost while doing so, and improving compliance. Today I'm recording this video to focus on security compliance through cost savings. What we see is that hospital environments are very inefficient and unsecure as it relates to copy, print, fax, and scan. Typically, we see these types of workflows in hospitals. A nurse's station where there may be HIPAA violations related to faxes being in an output tray, unprotected fax machines, something where patients or visitors can access them, print and output trays, unprotected papers, no authentication. Here's another one where there may be workflows related to printing a document, then faxing a document and putting it in the shredder bin. We have unprotected fax machines, print and output trays, unprotected print. If someone is faxing something, how do we know they're dialing the right number? There's no authentication related to gathering this output or sending a fax. So breaches occur. Faxes are sent to the wrong destination with patient information on them, and this is causing HIPAA breaches. Other workflows are paper-based workflows where documents are being routed either from clinics to hospitals or within hospitals where there's 12 different potential breach points of that patient health information. So NSI offers a secure information exchange, a way to capture either paper or electronic documents, process those documents, and route them securely to your intended destination. So my focus today is on security compliance for copy, print, fax, and scan. On September 23rd, that was the last date for the HIPAA Omnibus rule, which strengthened the impact in 5 different areas, gave greater power to the Office of Civil Rights, tighter security and governance focused on privacy rules and security rules, greater fines and criminal penalties associated with not adhering to those rules, greater breach notifications, and greater extension of PHI liability with business associates being involved. The Office of Civil Rights enforces the HIPAA privacy rule, the HIPAA security rule, the HIPAA breach notification rule, and the patient safety rule. The U.S. Department of Health and Human Services and the Office of the National Coordinator for Health Information Technology has recently released a risk analysis tool. In that tool, they mention Copiers 15 times as a workstation that needs to be protected with administrative safeguards, physical safeguards, and technical safeguards. Copiers are workstations, and so the same rules that apply to workstations now apply to copiers. Copiers also have native functionality like scan to folder and scan to email, or have analog fax cards that have scan to fax. All of those items may be HIPAA violations if you don't know who the user is, if you haven't restricted access, if you don't have an audit trail, if there's no encryption. So there's approximately 1 million copiers in healthcare, which means there's 1 million breach enablers. Here's the legislation related to the HIPAA Security Rule. On the left-hand side here is a summary, which can be found on pages 1033 and 1034, that summarizes the administrative safeguards, physical safeguards, and technical safeguards. But let's look at the legislation itself. Let's start with security standards and the general rule to ensure confidentiality, to protect against unreasonable anticipated threats or hazards. In this area, the transmission of data is very important, and NSI can help mitigate that and focus on either data at rest, data in motion, or data in use. With data in motion, we're able to encrypt the information between the copiers and the Notable Solutions servers. Or we can encrypt the data itself. As the user tries to send something, we can create a password-protected PDF. We can also review the information, and if patient health information is found on a document, we can stop the transmission, and if no information is found, we can send the transmission. With these standards, there are some required areas hospital entities must implement If we look at those standards, let's start with administrative safeguards. A risk analysis, for example, is required. And that's where the tool comes in that's been created by the Office of the National Coordinator for Health Information Technology. They had a webinar just recently, and in this tool, they mentioned Copiers 15 times. But it's not enough that they mention that, leaving out a lot of information related to print and fax and scan as well. So we've created a threat assessment scorecard focused on data at rest, data in motion, and data in use as it relates to print, copy, fax, and scan. A copy of this and attached to this video. Information system activity is required using audit logs. What we're able to do is help create an audit trail as copy, print, fax, and scan is being implemented, where we know who the user is, the device that it came from, time and date information, all that information you see on the left. So also attached to this video is a white paper related to high-tech omnibus and HIPAA compliance and the importance of audit trails. Another requirement is that a security official be responsible for the development and implementation of policies and procedures. And then the workforce needs to be trained. So it's time for action. Do you know who is the security official at the hospital? Access authorization. Implement policies and procedures through access to a workstation. Well, earlier I mentioned the federal government is viewing copiers as workstations, which they are, and authentication is important with automatic log off. So NSI can provide for card authentication, PIN authentication, or two-factor authentication, combining the two things. This is what it looks like on a RICO device, where a user would simply use their existing HID card to authenticate onto the copier. And once they've authenticated, then we can provide access control to different features on the copier or different workflows. Again, another section where they talk about the importance of a user's right to access a workstation, and authentication is important here. We can also sync with Active Directory. The next section here on the left-hand side is focused on security awareness and training. It's going to be virtually impossible to train the users on the risks associated with copy, print, fax, and scan. These workflows that I was showing earlier will remain prevalent unless you adopt a strategy or use technology that focuses on data at rest, data in motion, and data in use, where we can provide technology to limit risk. An example of that would be needing to print something. Maybe from an application like the electronic health record, the user would first authenticate, and then they would select which job they want to print that's associated to them. Or if they wanted to send a fax, we can limit the fax destinations based on a database, or limit the ability for them to even key in a number and just show them a pick list of fax information. This way, you're using technology to be able to copy, print, fax, and scan securely. Security incident procedures is another place where audit trails come in, and where NSI can keep track of all print, fax, scan, and copy, and allow for an audit trail to be created. Another requirement is related to contingency plans, and NSI can help here by providing procedures focused on downtime forms, downtime registration, downtime prescription, reporting, discharge, referrals, even access to the medical application report. And at the end of the downtime, we can create workflows that reintroduce the scanning of these documents back into the appropriate destination. The next major area here are physical safeguards. And part of the physical safeguards is that the entity needs to restrict access to electronic information systems and the output of those systems. So another way that we can help is like the secure printing that I mentioned earlier, where the user first authenticates and then selects which job they want to print, and it prints down. The other area here are these types of workflows where analog fax machines are being used. All the analog fax machines should be discarded, and the user should be faxing through the copiers. That way they can authenticate and fax securely. Another area here is keeping records of the environment, and NSI helps during the implementation process of documenting all of the ways that the print infrastructure will operate. The legislation mentions over and over the importance of workstation security, and since copiers are workstations, it's another area where authentication plays in and access control plays in. Another important area here is device and media controls and implementing policies and procedures for the disposal of information. I think everybody is aware of the CBS story where there's information on the hard drive of the copier that led to Affinity Health Plan having to pay a $1.2 million fine. But the hard drive isn't the only area that you need to be concerned about. Copiers also have information in memory. SMTP server IPs, Exchange IPs, SMB shares, user email address books, service accounts, on and on and on. None of this would be visible if the copier was using NSI, because the only thing it would know is the IP address of the AutoStore server. If we look at technical safeguards, in technical safeguards, again, they address access control and how important authentication is and how important access control is and how we can help with that. Again, they mention emergency access procedures to health information. So these are downtime procedures where we can help in the 8 areas identified earlier. An example workflow would be here where the patient reporting system is sending PDF files into a folder on a periodic basis. Output Manager would monitor those folders, pick up any PDF files, and distribute them with a secure PIN onto the hard drive of the copier. That way, in the event of downtime, the user would simply walk up, select which file they want to print, enter the PIN number, and print the job that has been burned onto the hard drive. Another area here is automatic logoff. Again, that's part of the authentication where we can provide automatic logoff. Encryption and decryption are important. As I mentioned earlier, NSI can encrypt the traffic between the copiers and the Notable Solution servers. We can encrypt the files themselves, and we can encrypt dynamically based on information that may be found within those files. Audit controls, another place where audit trails are going to be important, and in addition to audit trails, we're able to enhance the use of data loss prevention software by OCRing all of the documents up front, so the data loss prevention software can look for protected health information and act on it. The other area related to technical safeguards is again focused on access control and authentication, and in the last area here on encryption. And again, we can encrypt the traffic, we can encrypt the files, or we can encrypt the information in a dynamic way. So we've gone over a lot of information. Again, here's a summary of that found on pages 1033 and 34, where we were focused on administrative safeguards, physical safeguards, and technical safeguards. We also reviewed the security risk assessment tool that was put together by the Office of the National Coordinator for Health Information Technology. We reviewed the threat assessment scorecard related to print, copy, fax, and scan. And attached to this video is a white paper where we have put together all of the items focused on each section, sample policies and sources and what NSI can do, and all the illustrations related to a comprehensive policy covering the use of copiers, printers, fax machines, and scanners as it relates to HIPAA compliance with the security rule. So as I mentioned earlier, our focus is on security compliance through savings. The savings comes in 80 different ways, and it's focused on 3 different categories. We can provide hard cost savings associated with print, scan, fax, and mobility. We can provide process improvement savings, and we can help you increase your revenue. If we focus on hard cost savings here, here's 40 different ways, 10 of them associated with printing, 10 of them associated with faxing, 10 of them associated with mobility, and 10 of them associated with scanning. We'd be happy to set up a meeting and go through these and provide you different ROI tools so you can calculate the savings for your environment. So thank you very much for watching this video. Again, our mission is to support your mission, improving patient care, reducing cost, and improving compliance. If you have any questions related to this video or any of the content, I can be reached at my email address located on the screen or my cell phone number. Again, thank you very much.